Hi everybody, Scleroderma Smarter here. Trying to do something new today. I got a little tripod, so I will not be holding the camera. My lighting is bad and I look horrible. However, I just wanted to come on here and do a video regarding my feet and the issues I have been having with them. Sorry if I'm a little out of breath today. I guess I just overexerted myself this morning and just wanted to get this done. So, if you don't know, scleroderma is a overproduction of collagen, and it gets into the connective tissue. And when that happens, it causes tendons, muscles, skin. With me, it's my intestines, esophagus, and lungs to become fibrous, thick, and it becomes hard. I have been on Salsept for about 3 years, maybe 4 years, and it's actually really softened up my skin. Actually, this part here, it just hangs off the bone there. So, but compared to the way I was before, I'm a lot softer and doing pretty good. The issues with my feet are, and I borrowed a neighbor's little Barbie, because this is the best way I can show you what I have been dealing with for years. So really quick, got diagnosed in 2014, and that whole first year I spent in bed, and my body just pretty much went fetal. I was curled up in a ball with my knees up to my chest, and I couldn't even lift my head. I lost all of my core strength here, and everything across the back of my body, the back of my thighs, my calves got so hard, it actually caused like all of this to contract inward to where I was actually walking like this on my toes for about a year. And then I fell and broke my knee, had to learn to walk again. And even after that, I was walking on the balls of my feet. So the reason I brought this little doll here is just because this is a perfect example of what happens. So all of these muscles and tendons back here got so tight, it actually would lift up my heel. I walk on my toes, and after some therapy, when I would try to put my feet flat, I would actually be pulled forward. So I couldn't walk flat foot without going forward, and that's part of the reason why after I got out of bed in 2015 and started trying to walk again, I just lost my balance and went knees first and fractured the right femur at the knee. So I had to go through therapy. I went into water therapy, and with that, it strengthened up all of this where I was able to stand straight. And I have been getting what are called Bursa shots or Bursa injections. And what they do is they go right here into the hip. I'm sorry, they're doing construction on the street outside, if you could hear that. So what my pain doctor, this is all through my pain doctor, what he does is he goes right here into the hip, in between the bone there to the nerve, and just shoots it up with painkiller. This is what we call the Bursa shot. What I was doing also was here in the calf area, I was actually getting Botox injections. And what we were hoping that would do would be to kind of deaden or loosen or the muscles in the backs of the calves to help me learn to put my feet flat. So when we do here is the calf. So what they did last time was just did about 20 injections like that into the back of my calf. And what it did do was it allowed me to start to bring my heel down and start to walk normal. Now that does wear off, so I was getting that done every like 3 to 6 months and stuff. Once I was able to put my heels down, then I no longer got the Botox injections. but I continued to get the Bursa to help with the pain. For some reason, my right leg, ever since I got diagnosed, the way I said it was, it's like my brain is telling my right leg to move, but the right leg just doesn't want to listen. It wouldn't cooperate. I couldn't lift it. I still have issues like lifting the bottom part of the foot, lifting it up from the hip. So walking upstairs was a challenge, still is a challenge. I'm still working on that. Hopefully I'll get back into water therapy. After I broke the knee, I was walking in the pool because I wasn't terrified of falling and breaking my leg again. So we're hoping that by doing sorry, I'm all sweaty here. We're hoping that by doing the Botox injections again, the Bursa shot for the pain, it's going to help. Now, what happened was when this part here was up, when my heel was up, and I'm walking on the ball of my foot all across the bottom here, I started to get calluses. Now, as the heel is going up, all these little muscles and tendons and skin in this area here is causing my toes to pull back. So now, if you look at my feet, okay, and here's the heel, here's this, my toes don't, you know how your toes are supposed to touch the ground here? Well, the tips of my toes are like up. They're kind of like that. So here's a toe. So it doesn't touch the ground here. And that's mostly the pinky and the second toe. And it's happening on both feet. And with that problem of it curling up, kind of, but just imagine the tips of this up. I have got huge calluses all across the bottom of my feet, and they hurt. So I saw the orthopedic surgeon yesterday, and what we are going to do, what we were talking about doing first was actually getting hammer toe surgery, where they will, you can actually YouTube it. Maybe I'll try to put some links down below so you could see. And that would get me like at least 6 weeks off my feet, they said. I'd have to learn how to walk on my heel with a cast. Pins would be sticking out. And what the surgeon talked about yesterday, what we're going to do, and we're going to schedule that, is he is going to go into the calf. We're going to do the right leg first, I think. It's going to go into the calf and extend the muscles back here. So it's just going to be one surgery here. As with my toes, it would be one whole foot, weight, and then the other whole foot. And it still might not get the heel down. So our whole point is to get the heel down, to take the pressure off the balls of the foot. And I will put a picture. I'll try to insert a picture right here so you can actually see, because if you look at the bottoms of my feet, you can actually see where the bone from the top, because you have your toes, and then here's like a digit, goes this way, and then here's like a digit, and then it connects to the foot here. Well, this bone here, since it's pushing this all up, you can see this bone right here sticking out on the bottoms of my feet. So I'm walking right on my toes, on the balls of the feet, standing, and they hurt. They hurt all the time because all this right here is just constantly tightening. Kind of see how it's going on with my hand here. So you see how that is now. If you look at the bottom here, you can see the, I should know these bones, but the bones that are going across the hand here, because, there we go, see that? So that's happening also on the bottom of my feet, because it's pulling it up. So if you hold your hand straight and you pull your fingers up, you can see that bone stick out on your hands. Well, when I try to go flat, you could see them. And you could tell that the middle one is the worst. So, unfortunately, we cannot video record the actual Bursa procedure because I really wanted you to to know about that because a lot of people have asked me about that. And we are hoping that I'm just going to get some relief. The pain is unbearable. It feels like I'm constantly being stepped on with like steel toe boots, or it feels like I'm wearing really cheap high heels with no padding on the bottom, and it's painful. So a lot of it is just to try to help relieve the pain and fix my feet. So if you guys have any questions, you go see your pain management, ask them about Bursa, and see if you qualify for Botox. I know I have one friend in Texas who gets it in her hands. Her hands claw up like this, and she gets the Botox in her hands to help release them, and because they tighten up. And luckily with my crafting and my nails, I haven't gotten that bad. This is just because I haven't been doing a lot lately. So if you guys have any questions, leave it below, private message me, follow me on Instagram at Scleroderma Smarter, and on Facebook at Scleroderma Smarter, and I will upload this video as soon as I finish it here, and hopefully I'll be able to help some of you out there. And don't forget to be Scleroderma Smarter.